Gormagat, Cathaoirleach, and good evening again, Minister. Minister, I'd like to focus this question on the Army Nursing Service and specifically the Army Nursing Service review, which I understand may have been ongoing for the last little while. So if the Minister could confirm or could indicate when did the review commence, when is it likely to finish, and if you could make a statement on the matter. Thanks very much.
Thanks, Deputy. You always ask searching questions, to be fair to you. This is a sector that you understand very well for obvious reasons. The Civil-Military Joint Standing Committee on Medical Service Delivery is tasked with advancing the development of a sustainable integrated medical service to meet the needs of the Defence Forces. As part of its work, it has committed to reviewing each key medical capability separately. The objective of each review is to evaluate and make recommendations regarding the most appropriate means of delivery for each service to the Defence Forces. These reviews are conducted on an ongoing basis as the workload of the committee allows. On this basis, a review of the Army Nursing Service was commenced in March 2020. A subgroup to the main committee has been established and is currently progressing its work with a view to the review being finalised by the end of this year. It should be noted that the work of the Joint Standing Committee was impacted by the onset of the COVID-19 pandemic. The objective of the review is to document and evaluate the current and historical service provided by the Army Nursing Service, examine the recommendations of previous reviews, provide an overview of relevant legislation governing the Army Nursing Service, nursing in Ireland, and where possible, international best practice in military nursing, consider the potential future role of the Army Nursing Service and nurses in the context of the Medical Corps and Defence Forces operational capability, and to present options regarding the most appropriate means of delivering nursing services to the Defence Forces. The Army Nursing Service forms part of a wide range of medical services that are provided to the members of the Permanent Defence Forces. These include an annual medical examination, sick parades, attendance at GP surgery, outside of sick parade and out-of-hours GP services, prescription services, laboratory services, physiotherapy, radiology, mental health services provided by an in-house psychiatrist and 2 in-house psychologists, inpatient and outpatient public hospital charges and routine dental treatment. So this is an important service. In fact, it's an essential service that's provided to our Permanent Defence Forces. The review should conclude before the end of the year.
Thank you again, Minister, for that genuinely useful and very, very helpful response. Look, what can I say about the Army Nursing Service? It's a fantastic component of the Defence Forces. It's a service that's in decline, though I assume you'd also agree with that. From its heyday a number of decades ago, when there was about 100 nurses, to now there's only about 3 or 4, and that's a really, really big pity, because they would have been really, really useful over the last 15 months during the pandemic, both inside the Defence Forces and also from a nursing homes perspective and dealing with the wider public. I guess as well, the nurses the majority of the nurses currently deployed by the Defence Forces, they're actually agency nurses, which are really, really expensive. And indeed, in one barracks in the country, there's an agency nurse that has been re-employed on a 24-hour basis every day since 2012, which is definitely a very suboptimal situation from both her perspective and both an organisation perspective as well. So I'd be grateful if the Minister could expedite that nursing review, and let's get decisions made and let's get nurses back into the Defence Forces where they belong.
Yeah, no, look, I'll follow the progress of this review closely. Of course, a nursing service is essential to our Defence Forces. It needs to be available to all serving personnel. And of course, we have made a commitment in the programme for government in terms of medical facilities that are available to officers in the Defence Forces should be available to all serving personnel, and that's going to be a commitment that takes a bit of time to implement, but I'm certainly determined to do that. As I say, I'm happy to commit that this review will conclude before the end of the year, and we'll see if we can complete that review at an earlier point, and I take on board what the member has said.
Berry.
Thanks again, Minister. Look, just to emphasise, and I'm sure you agree as well, that the nursing component of the Defence Force is hugely, hugely important because of their scope of practice and the particular skill set and indeed mindset that they bring to proceedings, particularly from an overseas point of view. And it would be unusual among the EU 27 that a military does not have an army nursing service, particularly from an overseas point of view. I mean, we haven't had a casualty overseas, thankfully, for 16 or 17 years now at this stage, but we really are on borrowed time. And if we get nurses in, we should be able to deploy them overseas like any normal military. And that's really, really important because we need to de-risk our operations overseas, that we have to prevent our next casualty from becoming our next fatality. And to me, having a functioning and well-resourced and well-staffed Army nursing service is absolutely crucial and critical from that point of view. Thank you very much.
I mean, just to reassure the House that in terms of our overseas deployments, of course we always ensure that there are appropriate medical supports and medical facilities and nursing staff available to our serving personnel. That normally means that we embed our serving personnel with others. In the case of Mali, we're very much embedded with the Germans. I remember actually when I visited the EU training mission, there was a German medical facility as part of that training mission that was responsible for looking after the medical requirements of the Irish serving personnel there. But having said that, of course, medical expertise, medical staff and nursing staff are a very important component part of a rounded and functioning defence forces, that is, I hope, what we can deliver following the review that's being undertaken at the moment.